हेलो फ्रेंड्स, वेलकम बैक टू माय यूट्यूब चैनल। नमस्ते दोस्तों, मेरे यूट्यूब चैनल पे, मेरे फेसबुक चैनल पे, मेरे लिंक्डइन चैनल पे आप सबका स्वागत है। और मैं हूं डॉक्टर गोविंदा गुप्ता, नई दिल्ली इंडिया में एक मेंस हेल्थ या मर्दों के रोगों का स्पेशलिस्ट, और जिसके अंदर हम पुरुष के ऑलमोस्ट सारे डिजीजेज या मेंस हेल्थ की सब प्रॉब्लम्स कवर करते हैं। मेरे बहुत सारे वीडियोस हैं मेंस हेल्थ पे, बहुत सारे वीडियोस है मर्दों की प्रॉब्लम्स पे, कैसे मैं अच्छा इलाज करता हूँ या कैसे मैं बेटर इलाज करता हूँ। बट आज का वीडियो या जो आज के टॉपिक्स है, ये बेटर इलाज के नहीं है। ये कौन अच्छा इलाज करता है, कौन बेहतर इलाज करता है, ये खुद को प्रमोट करने के या खुद को मार्केटिंग करने के वीडियोस नहीं है। आज के जो ये ट्यूसडे के जो लाइव्स है, ये ट्यूसडे के जो टॉक शोज है, ये टॉक शोज में आपके लिए दुनिया भर से, जो पूरे वर्ल्ड में जो मर्दों के डॉक्टर्स हैं या वर्ल्ड में जो बेस्ट एंड्रोलॉजिस्ट है या वर्ल्ड में जो बेहतर इलाज कर रहे हैं, उनको लेके आपके साथ जुड़ूंगा, ताकि उनके एक्सपीरियंस से हमें तीन फायदे होंगे। पहला, तो आप जान पाएंगे कि पूरे दुनिया में क्या हो रहा है, क्या इंडिया पूरे दुनिया से कैसे जुड़ा हुआ है और बाकी डॉक्टर्स अपने मरीजों का इलाज कैसे कर रहे हैं, और कैसे हम इंडिया के अंदर भी वर्ल्ड का बेस्ट इलाज प्रोवाइड कर पा रहे हैं। दूसरा, अगर आप इंडिया में नहीं हैं और वर्ल्ड के किसी कोने में हैं, तो आपको अच्छे डॉक्टर्स के बारे में पता चलेगा। और तीसरा, जो भी लेटेस्ट है वर्ल्ड में, वो आप तक पहुंच पाए, यही मेरी कोशिश है। तो आज मैं आपके लिए लाया हूँ डॉक्टर नबील अमीन, डॉक्टर मोहम्मद नबील अमीन। डॉक्टर साहब इजिप्ट से है, इनके 4 क्लिनिक्स है इजिप्ट में। इनके फादर भी बहुत बड़े एंड्रोलॉजिस्ट थे। डॉक्टर नबील अमीन क्लिनिक्स बहुत फेमस है इजिप्ट में। सर काफ़ी सालों से मरीजों का इलाज कर रहे हैं। 1988 से डॉक्टर साहब ने हज़ारों पेशेंट्स ठीक किए हैं। अभी फ़िलहाल पिनाइल इम्प्लांट्स में काफ़ी आगे है। मैंने इनके साथ भी टर्की में ट्रेनिंग की थी, इजिप्ट भी हम जाऊँगा कभी तो आपको मिलवाऊँगा। तो आज हम डॉक्टर नबील से बात करेंगे। तो लेट मी इंट्रोड्यूस हिम टू डॉक्टर नबील।
Hello.
Hello,
Hello,
Dr.
Dr.
Mohammed.
Gupta. How are you?
I am doing very well, my friend. It is so nice to see
Hi.
you after so long.
2 years.
Yes,
I'm so
and
happy to
Corona in the
see you
middle.
again after we exactly. That what
Yes,
made everything stop after our last visit to Istanbul through the Rigicon company that we have been invited to see in Istanbul a lot of Infla 10 and Rigi 10, and we had a very good experience, and we shared the experience together. I really learned to use a lot of tricks through our visit, so I'm happy to see you again.
थैंक यू सो मच। सो डॉक्टर मोहम्मद से जैसे बताया था, मैं टर्की में मिला था, इस्तांबुल में रिजिकॉन की ट्रेनिंग में। मैंने इनसे बहुत सीखा, इन्होंने मुझसे कुछ सीखा। तो हम आज जनरल बात करेंगे। तो डॉक्टर मोहम्मद, हाउ इज द वेदर इन इजिप्ट? हाउ इज इट इन इजिप्ट? इन दिल्ली इट्स वेरी हॉट, द monsoons are here, it's very humid. How's the weather there in Egypt?
I'm sorry, can you repeat because I didn't hear what you say?
I'm saying, how is the weather in Egypt? How is the weather there? It's very hot here in India right now.
Very hard what?
It's very hot here. It's the temperature is very high here.
Exactly. And but it doesn't make a difference through our practice except post-operative, because hot weather, people are sweating, and what makes some challenges in post-operative care for the wounds.
Yes.
But it doesn't make change on the procedures itself. If you mean like hot weather can make any problem with the procedures, or the benign procedures can be affected from the hot weather. Just after the
Okay.
wound has been closed, everything will be okay.
So, can you hear me clearly, or do you want to adjust your mic? We can do that.
I yeah, I have a mic in my iPods, but the problem with some problems with network, I think. But I now can
Okay,
hear you clearly.
you can hear me clearly. So, Doctor Amin, how is men's health issues in Egypt? Do you get a lot of erectile dysfunction patients in Egypt, like we get in India?
Ac- actually, in Middle East, most of the Middle East and Arab countries, there is a lot of problems about sexual health because a lot of myths, like yeah, like a very common thing is the honeymoon impotence. It's very common in the Middle East because we have a lot of myths about preparation for wedding, and most of men don't have previous experience in sexual life before marriage. So you have a big fear from the first intercourse. That's why we call honeymoon impotence. And actually, it's like 60% psychic and 40% we can call it psychic on top of organic. Um, we have also some problems like after marriage. If someone has an erectile dysfunction, he don't go to the medical physician directly because he thinks that he has been cursed. That I don't know what's happening with in India or not, but he go to the people who are curing curses before going to the medical physician.
Okay.
We are trying through the media to change this culture because as much as we can. And here we can also change. I don't know it's in India or not about talking about curse
So it is very
or
similar
problem.
here. It is very similar here. So in India
Exactly.
also, yes. So in India also, young men, they get scared before their sexual life starts, and then they become
And
so scared they can't do it at all. And before trying any treatment, they will go to local doctors for magical cures and magical remedies, which never work.
exactly,
And
exactly.
yes,
And that's why here we have a lot of ways to investigate those patients and to differentiate between psychic and organic elements, like Rigiscan, like Penile Doppler. We can differentiate between psychic element and organic element definitely, and
so
that's
I will just like
how
to explain to
we
my
can tell.
patients. सो डॉक्टर नबील जो है वो कहते हैं कि जैसे इंडिया है वैसे इजिप्ट के अंदर भी सेक्स एजुकेशन जो है वो स्कूलों में नहीं देते और मरीज जो है वो काफ़ी मतलब उनके अंदर काफ़ी ज़्यादा मिस इन्फॉर्मेशन या एजुकेशन नहीं है इस कारण से वो काफ़ी अलग अलग तरह की मैजिकल ट्रीटमेंट्स अननेसेसरी ट्रीटमेंट्स कराते रहते हैं सेम लाइक इंडिया इंडिया के अंदर भी मरीजों में इन्फॉर्मेशन होती नहीं है इस कारण से कई बार गलत गलत इलाज कराते हैं या मैजिकल इलाज कराते हैं या आयुर्वेदिक इलाज कराते हैं आयुर्वेदिक तो ठीक है फिर भी साइंस है बट कई बार आयुर्वेदिक वाले भी प्रॉपर दवाई देते नहीं प्रॉपर जांच करते नहीं और कई मरीजों में डर के भावना जिससे साइकिक या साइकोजेनिक ईडी डेवलप हो जाता है और बिना टेस्टिंग के बिना जांचों के लंबे टाइम दवाइयाँ लेते हैं डॉक्टर मोहम्मद भी इजिप्ट में काफ़ी टाइम से अपने लेवल पे मीडिया से और तरीकों से लोगों को एजुकेशन करने की कोशिश करते हैं so Dr. Amin being a predominantly Islamic country with lot of uh, uh, like in India also we can't openly talk about all this so have you had problems with trying to get across to your patients like in India also these things are very quiet there's a lot of cultural culturally people don't talk about it they keep it secret and because of which they keep suffering so do you have similar there
Exactly. I'm like always say that my patients if he saw me in the street, he don't know, like he cannot say that he know me, because if he knows me, he say he could be one of my patients. People here in
Okay.
Egypt have a very big fear in talking about sex, about sexual life, even with his wife, not only
Okay.
with other friends and stuff like that. And also, women don't have also like the sexual education, or enough sexual education to know what's the problem with them. So if someone have an erectile dysfunction, he just say I'm okay. I'm telling and he's telling his life I'm okay and such like that, and his wife as well don't talk with him until she is convinced. That's why a lot of cases of divorce has been increased. Those like this the last 3 years, we have about 90% divorce rate through the last 3 years.
Okay. So that is a very interesting point. Is impotency a reason for divorce, an acceptable reason for divorce in Egypt also? Like it's acceptable in India. In
Exactly.
India,
I,
a
I, I
woman can ask.
yeah. In my
In India,
opinion, yes.
okay. No, in India, a court will grant a woman divorce if the man is impotent. In Egypt also, will a court grant a woman divorce if her husband is impotent?
The woman divorced or what? I didn't hear.
Now, in India, a woman can ask for divorce if her husband is not
Exactly.
potent. Can in
Actually,
Egypt also?
it's a yes, sure, because it's her right. It's her right. If she cannot get her sexual arousal and sexual life good enough, she has the right to divorce, or to, because she is not forced for that. But I prefer to go to the physician, because I think now there is no impossible in treating erectile dysfunction. Even now, at the end of the way, we can do penile prosthesis, and penile prosthesis have like 100% powerful erection. So there is no problem in erectile dysfunction, but we should go to the physician if we have any problem as soon as possible. Don't wait till making psychic element on top of the organic. That's the problem that we have, that people are waiting. They don't go to the physician to diagnose and begin the treatment as soon as possible. Problems come after that.
सो डॉक्टर नबील बताते हैं कि जैसे इंडिया के अंदर भी अगर मर्द में प्रॉब्लम है या आदमी परफॉर्म नहीं कर पाता तो कोर्ट्स डाइवोर्स दे सकते हैं। उसी तरह इजिप्ट के अंदर भी अगर मैरिज ठीक से नहीं चलती है या इम्पोटेंसी रहती है तो कोर्ट्स जो है डाइवोर्स देते हैं, और इस कारण से इजिप्ट में यंग डाइवोर्सेस के लेवल्स बहुत बढ़ गए हैं। और क्योंकि मरीज डर जाता है, एजुकेशन इंफॉर्मेशन अवेलेबल नहीं है, गलत चक्रों में पड़ जाता है, तो उसको साइकोजेनिक है, दिमाग के अंदर भी कई बार बहुत सारे वहम कम्युनिटी भर देती है, बहुत सारे वहम कंपनियां भर देती है, पर अच्छा इलाज कराने के बाद बहुत सारे मरीज ठीक हो जाते हैं। So, doctor, what is the proportion of young patients in your practice? How many young people come for an implant in your practice in Egypt?
Recently, we saw a lot of young patients. I think, in my opinion, that has been increased because of a lot of bad habits has been done in here in the last decades, like smoking. Smoking has been increased in the Middle East so much, and I think increasing weight, very bad food and junk food, as you think, because people now have changed their habits in eating. Before like 20 years, people were eating vegetables, didn't eat a lot of saturated fat in their food. Now everything has been introduced to junk food, burger, sausage and stuff like that, that has been increased the vascular diseases. And as you know, erection is composed of three components: vascular, neurogenic, and endothelial. So if most of like those three bad habits increase the rate of erectile dysfunction due to vascular diseases. Vascular diseases
Okay.
has been not only in erectile dysfunction, it's also in all vascular diseases. Like we have a lot of cardiac patients in very small age. We have a lot of people who have strokes, stuff like that, as well with erectile dysfunction.
Okay. So you are so like even in India now, I am seeing a lot of young patients coming in 30s, 35, as compared to the elderly. And these young patients get a lot of relief after an implant. After a penile implant, they are very happy with the result. Do you notice the same in Egypt also?
Actually, we have less than 30s. We have 20s. We have done for
Okay.
20 patients, 22, 23 patients who has been, because also penile implants is not only for people who have severe vascular. If element has been introduced for more than 1 year, I think penile implant is a very good option. Because we
Okay.
don't leave someone with, like in any operation, you are make an equilibrium between the benefits and the problems. So if the patient tried medical treatment for more than 1 year and he cannot reach a good erection, so penile implants is a good option in that patient.
सो डॉक्टर साहब बताते हैं कि जैसे इंडिया के अंदर भी मैं अभी देख रहा हूँ रिसेंटली यंग लड़के इम्प्लांट कराते हैं और इम्प्लांट के बाद खुश रहते हैं। वैसे सर के पास भी कई बार यंग लड़के आते हैं जो 20 साल के हैं, 22 साल के हैं, 20 years, 22 years, एंड दे गेट एन इम्प्लांट एंड देन आफ्टर इम्प्लांट दे आर हैप्पी। सर कहते हैं अगर किसी मरीज को 1 साल से ऊपर दिक्कत है और 1 साल में दवाइयाँ नहीं काम कर रही, इफ somebody has problem for more than 1 year, then it is better that he considers a penile prosthesis as a result. So, like in India, you have a lot of local remedies for erectile dysfunction, like Shilajit and local herbs. Do you have something similar in Egypt? Local remedies that people try before coming to a doctor?
Local what?
Local remedies, yeah,
Dr.
local
Gupta, local what?
local remedies or local treatments or local herbs.
Ah,
Any locally
yeah,
available
exactly.
medicines?
Not only
Yes.
local herbs, exactly, like ginseng and stuff like that. But not only that, also there is a lot of people who are advertising through the online, like something XXX and stuff like that. Those treatments are not approved through FDA. Why we are saying approvement from the FDA as a treatment for any disease, not only erectile dysfunction? Because we can calculate the dose. All those drugs that we are using in our medical treatment has been composed originally from herbs, but the industrial treatment through the medical treatment has been passed through strict experiments, and we have calculated all the adverse effects and side effects of any drug. That's why we have to know the problem that could happen from any drug. But from the herbs, we don't know. Like we have in Egypt something it's called Hajar Gohanam or Hellestone. Hellestone is used in premature ejaculation. And when I tried to know what's it or what's composed from, I found it's like something destructive for making keloids for the patient. So it doesn't treat premature ejaculation. It stop any erection after that. As
Okay.
like yeah, because
Yes. So this that's that
a lot
dangerous
of
for the
problems I
patients.
saw after that. I saw
Okay.
burns. I saw burns.
Oh my God.
Sorry.
So that's very scary actually, for a patient to go through so much trouble. So, Dr. Amin, what has been your experience with the malleable penile implant? What do you think? If I have to give you a choice between an inflatable and a malleable, which penile implant would you prefer, and why? Or how do you choose
As
which
as
implant to give
as
which
we
patient?
say as we say before the operation, if the natural erection is good, so it's better than anything. So anything similar to the natural erection and deflation will be the better way. That's why we say that the inflatable is much better than malleable. But unfortunately, through the Middle East or I think in India as well, people cannot afford for the inflatable penile prosthesis. That's why it's more common than inflatable. But for sure, inflatable is better because it gives as much as we can for close to the natural erection and the detumescence. And also during development from the companies that is manufacturing the penile prosthesis, they have really changed the way how is inflatable 30 years ago. You know, because Dr. Nabil Amin, we begun doing penile implants 30 years ago. So we saw a lot of how the penile implants developed. We have They have stopped the auto inflation that happened from the inflatable. A lot of mechanical problems and has been stopped and didn't last anymore. Also, it gives more girth now, like something like device like Infla 10. Infla 10 now is expandable, and they have corrected the problem what was happened with herniation because of the four layers in it. Infection rates has been decreased a lot due to the hydrophilic coat. The hydrophilic coat of Rigicon also lasts more than any hydrophilic coat from any other penile prosthesis.
So
The
basically,
design
what you are trying to say
of the penile
is
prosthesis, it
that
was better.
is that uh, that because of the affordability issue, it's less, but you would prefer an inflatable any day over a malleable. And the new inflatable implants
Exactly,
are good.
exactly,
They have improved a lot, and now patients have very less
exactly,
complications. Okay. So for the inflatable, you have been
exactly.
using the Rigicon Infla 10AX. So I know for a fact that you have done a lot of cases now of the inflatable. So how do you find the implant? How is the Rigicon Infla 10AX? How do you find the implant? Are your patients happy with it? What's the results?
Well,
How do you find it?
I had no any problems till now with any of the Inflaten penile prosthesis and also the Regi 10. Actually, it's a promising company, Regicon. It has been it began with the last advances of the penile prosthesis technology. When we talk about Inflaten, the best thing in it is expandable because you know a lot of people through our area are thinking about the size, not only the erection. It gives a very good erection. It's durable. There is no any problems with the infection from it. There is no any mechanical problems, but also they care about the size. The size really increases through 3 to 6 months. It's easy in use because you know it's one touch press on it. It has a it's very big, and it's you can find it as a scrotum easily. A lot of people had problems with finding that before they do that. The pump itself is very comfortable. It's squeezing is very easy through it. And also, very good option that the company gave, that they are giving a warranty, a long life warranty. And you know that was a problem with the inflatable always because most of the companies are giving 5 to 6 years warranty. Now it's lifelong warranty, which make it secure for the doctor and the patient. even the warranty also for the infection is very beneficial. That means that the companies are trusting their devices well. They have been tested it for more than 150,000 inflation deflation. That's which give you 5 to 6 times daily to 6 years, which making lifelong really.
So you are very happy with the Infla 10. So for my patients, डॉक्टर नबील जो है वो काफ़ी लंबे समय से इन्फ्लेटेबल इम्प्लांट्स या पंप वाले इम्प्लांट्स अपने मरीजों में लगा रहे हैं और उन्होंने पिछले कुछ टाइम से रिजिकॉन का जो इन्फ्ला 10 है, जो नया इम्प्लांट है, वो अपने मरीजों में यूज़ किया है। और मैंने जितने भी डॉक्टर से बात की है, मेरे फॉरेन फ्रेंड्स से, डॉक्टर अमीन है, डॉक्टर हमदान है, डॉक्टर क्रेमर है, सबका जो रिजिकॉन के इन्फ्ला 10 के बारे में विचार है वो बहुत अच्छा है। लॉन्ग लास्टिंग है, बढ़िया लेंथ, बढ़िया मोटाई, बढ़िया लंबाई, बड़ा इजी है यूज़ करने के लिए, पंप बढ़िया काम करता है, पंप को भरना आसान है, पंप को खाली करना आसान है, पंप को डालना आसान है, ड्यूरेबल है, सॉफ्ट है, मतलब ओवरऑल एक और लाइफ टाइम वारंटी के साथ वाला एक बढ़िया अच्छा इम्प्लांट है। मेरे इन्फ्ला के पेशेंट्स भी काफ़ी हो चुके हैं, पर अभी सब फॉलोअप में है। मेरे इन्फ्ला के अभी आने वाले टाइम में मैं आपको वीडियोस डालूंगा, कैसे काम करता है, क्या काम करता है। बट जो स्टार इम्प्लांट है, इन्फ्ला तो है ही, जो स्टार इम्प्लांट है रिजिकॉन का वो है रिजी 10। So what I want to say, Dr. Amin, is that the Infla is there and it is a good implant and everything, but the star of the times today is the Rigi 10 or the Rigicon malleable implant. What has been your experience with this implant?
Yeah, actually, we have a very big experience in this device as well because we have been performed more than 90
Almost 100 now.
Rigi 10
A
till
cent-
now. Nah?
Almost 100 now. You're going to touch a century now.
Yeah,
Almost
exactly.
100
Yeah,
implants,
yeah,
yes.
exactly. This year will be
That's
inshallah, and we saw that there is a big difference in the rigidity. It gives a lot of variable sizes. We have six sizes, from 9 inch to 14, and it gives us a very good malleability because of the core itself. It gives 130 degrees of malleability, and also we have videos, but we will put the link after. We have videos for our patients after the operation and how they are tilting, concealing the penile prosthesis itself, how it's in erection, how its rigidity. People are very happy with this malleable penile prosthesis. Actually, now it's my preferable penile prosthesis through all the companies.
तो डॉक्टर साहब बताते हैं कि ऑलमोस्ट 100 केस कर चुके हैं, पेशेंट्स एकदम खुश है इम्प्लांट से, उसकी हार्डनेस से, उसकी लगाने से, हर चीज़ से। पर मैं इनसे दो क्वेश्चन पूछूंगा। आई वांट टू आस्क यू टू थिंग्स। वन, after the Rigicon 10 implant or the Rigi 10 implant, how are the patients satisfied with the size? Are they happy with the size of the organ after the implant?
Well, I have a very big problem in explaining to the patients that size is not the only matter. People through the Middle East or we have different races, and size is different from race to race and from person to person. Even from two brothers, they have different sizes: one short, one tall, one thick, one thin. That's why difference doesn't matter. But we during the operation we are trying as much as we can through the malleable prosthesis to put the largest size as much as we can. And what make us very comfortable through that we have a lot of sizes. We don't only have three sizes like other companies. We have a lot of sizes. We can adjust size as much as we can. But if someone is mattering really about the size, we prefer the inflatable, because inflatable, even if the size is not good enough, it will be good enough after the operation from 3 to 6 months. So
Okay.
if size matters, inflatable penile prosthesis is the best.
ओके, सो डॉक्टर नबील बोलते हैं कि अगर वैसे साइज इतना मैटर नहीं करता, अगर मरीज को इम्प्लांट के बाद अच्छा इम्प्लांट है, हार्ड इम्प्लांट है, टाइमिंग अच्छा है, पेशेंट इज वेरी हैप्पी, तो डजंट मैटर. बट इफ समबडी इज वेरी कंसर्न्ड अबाउट द साइज, देन इन्फ्लेटेबल जो हमारा रिजिड इन्फ्ला है वो अच्छा इम्प्लांट है, बिकॉज बिकॉज ऑफ द पंपिंग एक्शन. नॉर्मली द पेशेंट गेट्स अ वेरी गुड साइज 3 to 6 months डाउन द लाइन. 3 से 6
And
महीने में साइज बढ़िया हो
and
जाता है. यस.
and it's expanding as well, not only pumping, like it expanding. It gives like 40%, really. It gives 40%, 20 to 40%, because that idea has been gone from the plastic surgery, from the tissue expansion. If someone has a burn or such like that, and we want to make a flap or graft from an adjacent place, we make something called tissue expansion. We expand the skin itself through the tissue expanders, and this after expanding this tissue, we can make a graft. That's how it's going with the inflatable penile prosthesis. It's expanding through time from 3 to 6 months. It making larger penis in wider and longer.
And the second question that I have for you is the concealability of the Rigicon. So after the healing is over, how well are the patients able to bend it and conceal? Is the concealability good? How do you find the concealability, or how has your experience been?
That's why we're wondering how it's very rigid through the erection, and how it can be malleable itself. That's what make Rigidity special, because like in other devices we had like it's rigid, but we cannot do good concealment. Or it's good concealed, but it's not rigid. Rigidity has been two of them. It's very rigid through the erect position, and it's concealed easily, very easily during the concealment. As we can see in the videos that we put in the link,
Yes.
it's really hideable, cannot appear. It doesn't make any uncomfort for the patient, and also it gives a very good erection at the same time.
So डॉक्टर नबील अमीन बोलते हैं कि रिजिटेन हार्ड भी है और छुप भी आराम से जाता है. ऐसा डबल कॉम्बिनेशन नॉर्मली सब इम्प्लांट्स में नहीं मिलता. या तो इम्प्लांट बहुत हार्ड होता है या इम्प्लांट आराम से छुप जाता है. Rigid 10 has both. It is hard and concealable. So, Dr. Nabil, today we have with us Mr. Marcus. He's the head of global operations for Rigicon, and I wanted to invite him over so he could give us a small outline on the Rigi 10. So, for our patients. So, hi Ulas, welcome back. So we had you last time with Dr. Hamdan, and we have you again today. And we have Marcus. Also, I think he's gone for a tea break. So, Ulas, if you can introduce yourself and tell
Well,
us
it
more
is.
about the Rigi.
I am the vice president of the commercial operations in Rigicon. So we are joining here together with Marcus. It is great to see you. Last time I saw you was in Istanbul. There was no COVID. It was good days. So unfortunately,
Yes.
we had COVID in between and we couldn't see each other for a very long time. I'm just looking forward to seeing you, actually. So we have
Yes.
our senior vice president, Marcus, joining us from UK, from England. So
So we have
maybe
four
he'd like to
countries here.
talk.
We have someone from India, we have someone from Egypt, we have Ulas from Turkey, and we have Marcus from UK. And this is all so that our patients can get the best for themselves. So,
So we have
Marcus,
our
my
small
question,
United Nations. We have our
yes,
small
Absolutely.
United
yes,
Nations today.
yes. So, Marcus, if you could
Absolutely.
just introduce yourself for my
Yeah,
audience.
with pleasure. Good afternoon, good evening, everybody. Thank you very much, Dr. Gupta, for inviting us to join you this afternoon. Yeah, I've worked for Rigicon for some time. I've also been in the men's health penile implant for a variety of companies over the years. As is the team at Rigicon, we're fully committed to delivering high quality implants and really assisting people like Dr. Gupta and Dr. Nabil in being able to increase patient satisfaction. There's one thing a patient considering a penile implant. What we really want and are exceedingly passionate about is when a patient is considering a penile implant, they really do understand what the options are available, and specifically with the different types of implant, what is most suitable for them. And we try very, very hard to make that very easy for patients to understand that, and also for doctors to have a successful experience when they implant a patient. So with the Rigi 10 hydrophilic malleable penile prosthesis, there's a few things I'll highlight here. Firstly is it's very, very easy to implant, meaning, you know, the patient, when they are having any procedure, they should not be concerned. This is not a very, very long procedure. It's also very, very easy to size for a doctor, for the patient. So we are very fortunate at Rigicon. We have 6 different sizes available. We run from a 9 through to a 14 millimeter. So we really are able to assist your doctor with being able to tailor fit and size according to what is most suitable for you as the patient. And with that, it's very, very easy to assemble. So when a doctor is sizing, again, they're taking internal measurements to ensure that not one size just fits all, but the specific measurements the doctor takes for you, you get absolutely the right size, not just in length, but also in girth. So the doctor will always try to preserve as much and get you back to where you as closely were before, with obviously the diameter and length. And we're able to offer that with Rigicon because of the high degree of different sizes that we have within the portfolio. The other thing that we have on all of our devices, I will show you a device in a second, and we'll get into that in a little bit more detail, is every device that Rigicon has, we have a hydrophilic coating on that. And the hydrophilic coating is designed for 2 reasons. The first reason is to protect the patient. And what our doctor colleagues will confirm is they will use different antibiotic coatings depending on the hospital requirements and the best possible option to protect the patient, i.e. significantly reduce the risk of infection with the type of surgery the patient's having. So what happens in essence, they take the implant per se. This is one of our Rigi 10s. And as soon as it's opened, obviously in a clinical setting, it is dropped into the antibiotic dip just for a few seconds. And this stays in situ right up until the time it's implanted into the patient. So that's one of the reasons that we have a hydrophilic coating. The other reason we have a hydrophilic coating is really to help when the surgeon goes to implant. We need as much glide, as much lubricity as possible to assist when we are inserting, so that it slides in very, very easy, rather than us having to push exceedingly hard or the surgeon having challenges to get this implanted. So with the Rigi 10, when this product becomes wet with the antibiotic coating, it assists the glide, and in essence you get this. So it will help you as the patient, in addition to the sizes, what I spoke about a few seconds ago, get the best possible implant based on what your surgeon is able to get implanted into you. Equally as important, we're significantly trying to assist any implanter with not picking up any infections, which there's always a risk to any surgery. But our esteemed colleagues try exceptionally hard with what they're doing and their teams are doing to reduce that risk for you as the patient. So the other piece I was going to talk about, we have a very high bending angle on our implants, and it's very easy when you compare this to competitors just to sort of do this. When we talk about bending angles, we talk about really bending it properly. It's highly unlikely that you're going to bend it to this extent, but we do, believe it or not, when we are testing these in the lab before they come out. We test these to the point to in excess of 50,000 cycles. So this is a machine set up. It doesn't matter what size that we're using. We keep bending them. We are trying to break them. That's the ultimate objective here, to ensure you as the patient gets a device that is going to last for many, many years, and you're going to get a product that is of exceptionally high quality, where we've done a lot of the hard work in the manufacturing facility to ensure your device is not going to fail on you. Now, the other thing that we do, we look at axial rigidity. So obviously the pressure that's being applied onto the device. And as you can see, I'm giving a little bit of a demonstration here, not anything like how we do this in obviously a clinical manufacturing setting. We are putting up to about 6.6 pounds worth of pressure on the device, trying to get the device to collapse. Obviously, these are two different sizes, but as you'll know, patients, you end up with two of these, one in the right side, one at the left side. So this is very, very strong indeed, as you can see from what I'm doing here. And we are confident with a Rigi 10 that you are going to have one of, if not the best possible malleable prosthesis if you choose a Rigi 10. The device is 100% concealable, so nobody knows unless you decide to tell them that you have a penile implant. We also have worked exceptionally hard, so if you're traveling, if you're going through airport security, if you're going through any types of scanners, that the alarms are suddenly not just going to go off and you're going to be caused with embarrassment. So that's one less thing for you to be concerned about. To underpin all the things that we do at Rigicon, we have a lifetime warranty. I think both of our hosts today have talked about this. And whether you're implanted in Egypt or you're implanted in India, and you choose to move to the United States, or you choose to move to France or Germany, it doesn't matter. All we require is that your doctor registers the implant with Rigicon upon implantation, and that warranty travels with you, so that you have that added comfort that you're paying once, and you know that you have got a Rigicon device that is going to stay with you and is fully supported and underwritten by Rigicon. So we are very, very confident with the device, with the actual structure that we use. We use a steel titanium composite. In essence, the steel is running through the main core of the implant, and to give the additional strength, we have titanium, which anybody who will know anything about metals knows the quality and the strength of titanium. This gives the added support and reduces the risk of the implant buckling in any way, shape or form.
So thank you, Mr. Marcus. I think it was a very detailed explanation for Rigi 10.
Thank you.
So Marcus ने जो बताया वो ये कि जो Rigicon implant है वो पूरा का पूरा बेंड करने के बाद भी 50,000 बार 50,000 टाइम्स आप उसको बेंड अप कर सकते हैं। इसका मतलब ये है कि अगर आप दिन में 10 बार भी या 20 बार भी इस इम्प्लांट को ऊपर नीचे करेंगे तो भी ये इम्प्लांट आपको 30 साल 40 साल दिक्कत नहीं देगा। इम्प्लांट बहुत हार्ड है, इट इज़ अ वेरी हार्ड इम्प्लांट, तो यूज़ करने में भी बहुत ईजी है। इम्प्लांट के ऊपर हाइड्रोफिलिक कोटिंग है, इससे एंटीबायोटिक है, इससे पेशेंट्स को इन्फेक्शन का रिस्क नहीं रहता, और ओवरऑल एक बहुत बढ़िया क्वालिटी का लाइफ टाइम वारंटी के साथ a very good quality implant is being given to the patients. So thank you, Marcus. Thank you, Ulas, for joining
Pleasure.
us.
Thank you very much.
Thank you so much. And so, Dr. Mohammed, you heard the team from Rigicon. Do you agree with what our people said? Do you find the implant? Well, I have done around 10 cases now, and I find it very good.
Yes.
What do you think about it?
It's during our experience through like previous 90 Rigidity. That's really matters. Also, we didn't talk about the titanium. Titanium itself is really malleable. It make a concealment, very good concealment with the stainless steel, and that's why it's different. That Rigidity is different from the other devices. So what
Stainless
Mark
steel
said
plus titanium
is really
is
during
accurate.
our. Sorry.
So, what stainless steel plus titanium gives it very good strength.
Exactly. That makes sense.
Yes. Uh, so, Dr. Mohammed, apart from implants, you also do a lot of infertility cases. You also do a lot of men's health cases. So we
Yes.
will talk about it again one more day. I
Exactly.
think it's going to be a long talk on
Exactly.
that also. And thank you so
Inshallah.
much for joining me today and
Thank you.
sharing with my people in
It's my
India
pleasure to see you
your
again.
experience. Thank you so much. Take care, and I'll
Thank you.
get back to
Thank you,
you
Dr.
again
Gupta.
with another interesting topic. तो आप लोगों ने आज का लाइव देखा, थैंक यू सो मच सब लोगों को ज्वाइन करने के लिए। तो मोटा मोटा अगर आप आज का लाइव का समझें तो इसमें मैंने जो डॉक्टर नबील अमीन को बुलाया था इजिप्ट से, हमारा टारगेट ये था कि आप लोगों तक इजिप्ट के अंदर भी सिमिलर प्रॉब्लम्स है इंडिया जैसी, ये आपको समझ में आए। और वी नाउ हैव अ गुड ऑप्शन फॉर पेशेंट्स जिनको कंसीलेबिलिटी और हार्डनेस दोनों चाहिए। रिजिकॉन का रिजी 10 इम्प्लांट अच्छा है, पर फिर बस मेरी बात पे मत जाइए। मेरे बहुत सारे पेशेंट्स हैं जिनमें हमने रिजी 10 कर दिया है, उनके इंटरव्यूज आएंगे, उनकी सर्जरी आएगी। थैंक यू ऑल ऑफ यू फॉर ज्वाइनिंग मी, जिन्होंने अपना टाइम दिया मेरे को ज्वाइन करने के लिए। कीप सब्सक्राइब्ड, सब हैप्पी रहिए, खुश रहिए। क्वेश्चन आंसर के लिए एक दिन और फिर से मिलेंगे। थैंक यू सो मच, टेक केयर फ्रेंड्स।